So in reality, it's really, really, really rare. Like 2 to 3% of the general population actually have auditory processing disorders. You can't diagnose it by looking at a symptom list, because if you look at a symptom list, kids that have ADHD, autism, if they have anxiety, if they have a language delay, they're all going to have like the same types of things. So like, I have difficulty hearing in noise. I have difficulty with auditory memory. I have difficulty following multiple step directions. Like, they're going to have all of these very similar types of system issues. And it's really the difference between, is the sound getting in there and being used appropriately, or is it all these other things that are having effect on the sound and what the kid's doing with it, which makes it a little bit trickier, because as a parent, you're like, my kid doesn't listen to me, or they don't follow multiple step directions, or I tell them 5 times to go to the room and get this, this, and this, and they can't do it. It's got to be a processing issue, and it really may not be.
I'm Rachel.
And I'm Jessica, and this is All Things Sensory by Harkla.
We are both certified occupational therapy assistants, and together with Harkla, we are on a mission to empower parents, therapists, and educators to help raise confident and strong children of all abilities.
On this podcast, we chat about all things sensory, diving into special needs, occupational therapy, parenting, self-care, overall health and wellness, and so much more.
We are here to provide raw, honest, and fun strategies, ideas, and information for parents, therapists, and educators, as well as other professionals to implement into daily life.
Thank you so much for joining us.
Hey there, welcome back to All Things Sensory by Harkla. We are so happy to have you here for another podcast episode. I'm Rachel.
And I'm Jessica, and today we are talking to Debbie. She is an audiologist. She is local to Boise, and we found her through my favorite speech therapist, Amy, who we also interviewed on the podcast. Amy recommended that we chat with Debbie about auditory processing disorder, so that's what we're doing.
Yep, we hope you enjoy this episode. Let us know if you have questions, and let's jump in and meet Debbie. Hello, Debbie. Welcome to the podcast.
Thank you very much. Thanks for this opportunity to chat.
Yes. Before we dive in, we're going to ask you 5 secret questions. This is kind of how we learn all your deepest, darkest secrets.
Yes. These were not on the outline.
Yes. These are not in your notes.
These are not in your notes. These are from your heart.
Okay.
All right, first question. Would you rather always talk in rhyme or sing everything you say?
Sing everything I say. I'm an opera singer. So.
Oh my gosh! That's a great question.
Yes.
No way.
Yeah, so I've actually done that before, and it drives my children crazy.
I love that.
Oh, I bet.
I love it when the questions are just like perfect.
They fit perfectly.
Yeah, good.
Good. That was easy. See, that was easy.
It was easy.
Easy. Next question. What are you currently reading or listening to?
I am reading, oh my gosh, what is the name of the Throne of the
Court of
the Glass
Thorns
of Thrones
of Roses?
No, it's not that one.
Oh.
It's the Sarah Moss, the Throne of...
One of the series.
Yes, I'm on number 8, Kingdom of Ash.
Oh,
It's
wow.
the culmination of everything, and it's really a great series. I've really enjoyed it.
Okay.
I've buzzed through it faster than I thought I would.
I have the first one, but haven't started it yet. So.
I started the first one, did great. The little novellas, I wasn't as excited about them. I know it's supposed to like help clear up stuff once you get into the first several books, but
Oh, interesting.
not as well written in my thought process. But
Okay.
I'm really enjoying it.
Good.
Yeah.
Okay. Next question. Would you rather have to crawl everywhere like a baby for 1 day or hop like a kangaroo for 1 week?
Crawl like a baby.
Good. Good answer.
Not
Especially with your back.
Right.
I just feel like peeing my pants the whole time every day.
Jeez.
Well, I actually sprained my foot right before I got married, so I really was kind of hopping around, and that was just so awkward
So
trying to go up and
terrible.
down stairs.
Oh, yeah, the stairs would be
So,
awkward.
yeah.
Okay, we're crawling. Good.
We're crawling.
Good.
New perspectives.
Yes.
It would be. What is your drink of choice?
Oh, lately I've been doing, I like Truly's. I'm more of a seltzer girl.
Okay.
So I like pineapple cider, actually.
Ooh.
Been doing lighter things like that. Mm-hmm. Yeah.
Summer.
Sounds good.
Summer, yeah.
Yeah.
It's lighter.
Yeah.
Okay, our last question.
Okay.
And our most favorite question of them all.
Egads.
What is your sensory quirk?
My sensory quirk. Well, when I sing, I like to hold my hand over my ear so I can hear myself better.
Oh.
So if I'm having trouble or I'm just playing around in my car,
Okay.
I might be doing this.
So you get more of that auditory input. Are you an auditory, just out of curiosity, are you more of like an auditory seeker or an auditory avoider? Do you get overstimulated by a lot of noise?
I do now as I've gotten older.
Yeah.
Like my kids come, like I've been putting all my energy into my job and I come home and my kids are like, blah, 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 because I've got 4 of them, 3 at home. And so it just gets loud, especially in the car. They want to turn the music up and they're asking me questions and I'm like, oh my gosh, turn it down. I can't handle it. But normally I'm an auditory learner, so I just tend to do things a lot by ear.
Okay. Do you play the piano too?
I've taught myself. I'm not very good. I was a flutist and a violinist for a short while, and
So musically
I'm a singer.
inclined.
Yes, very much so.
And I think that makes sense with your background. I just like to connect it because your background is auditory, right?
Yes.
So it would make
sense that you gravitated towards your profession because of all of that.
Yes.
Okay, so now that everyone knows your deepest, darkest secrets, tell us who you are, what you do, why you do it, all the things.
Sure. Well, I'm a pediatric audiologist. I will be celebrating my 25th year at St. Luke's / Elks Rehab this like in the next 3 weeks or so. I only work with pediatrics, which is my heart. I have loved doing that. I used to say my patient base was from like 2 to 102, but I really liked when I got the opportunity to really like focus and dive really deep. Even in my profession, I really like literacy, like really trying to make the connections between listening development and language stimulation, and all those literacy things is huge. And I'm almost always recommending books to my patients. Like if they, I'll ask them, what are you reading right now? And I'll say, have you heard of this? And I literally yesterday gave a business card with like 5 different series I wanted this mom to check out with her child. Things that my kids have read, so I don't know what I'm going to do when my kids are all grown up and I don't have anybody to tell me what they're reading at the library now. But so I really like that. And I've always thought of myself many, many years ago, when I was thinking about this profession as like a bridge builder, like trying to connect people that are having difficulties and ones that are not, because it's all about communication and trying to really bring people together in a way that's going to be helpful.
Okay. So then what do you actually do in your day-to-day job with your clients? Patients?
Well, I test a lot of hearing. So that's probably the main thing that I do, is just trying to identify whether or not a child has a hearing loss that would be a reason for their speech delay or as part of their autism evaluation. If they failed hearing screening, parents are like, I'm not sure what's going on. And I identify actually quite a bit. I have a little kiddo that I identified in January. Her mom had been wondering about her hearing. She'd been fine at birth, like normal, all these things. And then one day she started holding up her toys to her left ear and she just couldn't, that's my right ear, but whatever. Couldn't hear real well. And she kind of watched it for a little bit and she comes into my office and the kids lost everything. And it was just like kind of crazy. And poor parents were drinking out of like a water fountain, fire hose with how quickly we were doing things. But yesterday she was in my office getting activated with her cochlear implant. So like full circle, this beautiful opportunity, still like drinking like out of a fire hose. There's so much going on, but like she's going to be able to do amazing things and not have her hearing loss be any type of impediment, which is awesome. And it's, right where her parents want her. She's going to be this. I mean, she's already verbal, talking up a storm, but it's just really cool. So I get to be part of that. I also work with auditory processing. Hence the reason we're chatting about that. I fit hearing aids. I do auditory brainstem response tests for babies that don't pass newborn hearing screening. I'm also one of the consulting audiologists for the newborn hearing screening program in our state. So I monitor regions 1, 2, and 3, hospitals and midwives, chat with doctors. I'll be doing a presentation for some midwives later this year. So
amazing.
I do a lot of things. Yes. And then I'm also the kind of the lead pediatric coordinator for our pediatric program, just trying to always pushing us forward, making sure that we're doing all the things that we should be doing.
So do clients come back and follow up with you, or do they go to a separate, do they go to therapy after they've been assessed by you, or do you refer back, or do they come to you weekly and work with you on things?
So I don't do therapy of any nature. Left that when I decided to become an audiologist. But I would say that people come back if they have hearing loss or if we've got some concerns. So it kind of depends on what exactly the problem is. I saw a little girl just a little bit ago that I was like, you probably have an ear infection. I cannot diagnose this, but it doesn't look any better than it did 2 weeks ago. So go see your doctor, and then based on what you and your doctor decide, I'll see you back either pre-ENT or just to see if everything's cleared up on your own.
Gotcha. Okay.
So like monitoring that. I monitor kids that have hearing loss because we're checking their hearing aids, ear molds because they grow. But those would be kind of the reasons I see them back.
But you do the evals and then you like refer out or go where they need to go and then check in as needed.
Yeah.
Okay.
Yeah.
So let's pivot to auditory processing disorder because that's really the goal here. We have so many, not clients, but listeners who are like, let's learn more about auditory processing. How do we decide what it is, what it isn't, and help our kids who are struggling?
Sure. Yeah.
So explain what auditory processing disorder is and what's important to know about it.
So auditory processing disorder is truly a bottom-up, my brain is not able to use the information that it receives. It doesn't have anything to do with any cognitive type of issues, neurodevelopmental issues, hearing loss. I mean, if you have hearing loss, you automatically have auditory processing disorder because your brain's not got all the information like it should have anyway. It has nothing to do with attention issues or language delay. So in reality, it's really, really, really rare. Like 2 to 3% of the general population actually have auditory processing disorders. You can't diagnose it by looking at a symptom list, because if you look at a symptom list, kids that have ADHD, autism, if they have anxiety, if they have a language delay, they're all going to have like the same types of things. So like I have difficulty hearing in noise. I have difficulty with auditory memory. I have difficulty with following multiple step directions. Like they're going to have all of these very similar types of system issues. And it's really the difference between, is the sound getting in there and being used appropriately, or is it all these other things that are having effect on the sound and what the kid's doing with it, which just makes it a little bit trickier because as a parent, you're like, my kid doesn't listen to me, or they don't follow multiple step directions, or I tell them 5 times to go to the room and get this, this, and this, and they can't do it. It's got to be a processing issue. And it really may not be, which is a conversation I have a lot.
I'm sure. Yeah. Because I'm sure that you get patients in there who think that their child has auditory processing disorder, but it's something else. So then what are the signs? I mean, you just listed off a couple of them, but how do you assess for that? How do you know?
The auditory processing?
Yes.
So it's about an hour's worth of listening tests that we're doing. And based on those tests and the results of those tests, which are all normed, that's something also that I think is really important to understand, is that there's really no national protocol, which makes it tricky because you could go to me and get a particular protocol, and you could go to a person in town elsewhere and get a different protocol. And the question is like, well, which one's right? And I don't necessarily know that I can tell you which one is right. I will say that we do a very good job. But really what we're trying to identify is what is that kid doing, and then how can we help them? And again, it's rare. It really is. So the people that tend to have like a whole practice that they've developed from auditory processing tend to use a protocol that, number one, doesn't really do what we call the cross-check principle. So in every hallmark of audiology, like every test that we do, it's a hallmark that we will test something, and then the next thing we test kind of has to line up to it. And if it doesn't, there's a problem. So if I'm testing kids, for instance, this happened to me yesterday, where I'm testing this girl, and she's got Down syndrome, so she's might be a little tricky sometimes. And I'm testing her, and she's not giving me real great stuff. And I'm like, okay, I'm going to stop and go to speech, because sometimes speech will be easier for a child to do. And totally did not do well with that. And I was like, So then I changed what I was doing. Audiology speak, I added some masking to keep the one ear, the good ear, busy. And suddenly I got a totally different result, right? But that matched up with my speech. So it's that cross-check. I have to make sure that they both make sense. And to my mind, we would have to do that with auditory processing too. You can't just do one test and go, oh, you scored really bad on that, and then do something else and say, oh, but you're fine. So that you have auditory processing because you scored poorly. Because that doesn't make sense. It could be a test issue. We have situations where the test is just really hard and the kid can't do the test. So we have to have more than one test per area. And so like at St. Luke's, we test 2 tests per area, and you have to score pretty similarly, so you have validity. If that makes sense. Did I answer your question?
I think so.
Yeah, and I guess like piggybacking on that, I haven't seen an actual test done, but I remember one specific client who took her kiddo probably to you years ago. I don't know, but they said, the test was really strange because he sat in this little white box with no distractions and had to listen. And she's like, I just don't know if that gave me the result that I was looking for, because that's not real life. So where do you go with that information when a child is struggling with filtering out competing backgrounds, and they can't listen to this instruction with the air vent blowing in the background or whatever? How does that test relate?
So remember, the auditory processing is a bottom up, right? So you're testing it to see can the brain do that task? So can the brain do auditory closure? So where it hears less information, or maybe it's garbled, maybe it's not complete, and can it fill it in? Can it figure out what that word is? Now, if the brain can do that, then that's not the problem. It might be the other things that are happening around that child that make the brain then go, oh, I can't pay attention to this task because that is more interesting to me. So that's where you have that like top-down problem where maybe the kid's distractible, or maybe the kid doesn't have, maybe they haven't learned how to listen well. That's like a huge thing that I see. And so it makes it harder for them to do the task. But the question is, can their brain do the task?
And if they can do it in a white room with no distractions, and we know that their brain is capable. We just need to train their brain to be able to do it in all these different environments.
Right.
Okay.
Right. So then you look at the other areas that they might be struggling. So if they have some attention things, even if it's not like attention deficit issues, if it's executive function, or they have initiative issues, that's going to play a role in how they perform.
For sure.
In any other situation. But that's not an auditory processing problem.
For sure.
So that's the difference.
Okay. So we're just making sure that the brain has the ability to do the skill in this great, pristine, prime environment. And they have it. So then here we go off into the world to practice and get better.
Right. And most of the time, like I said, that's what I see.
Okay.
Like we did a study of our clients, all of our patients in 2021. There's like 3 offices that do this testing, and we all follow a very similar, same protocol. We just changed it maybe based on if the patient needed an extra test or something. And when we looked at it, we had a 17% hit rate, meaning 17% of those kids that we tested had auditory processing problems in one area, for instance. Usually it's only one area. A lot of them also had other overlap of other things, where they had maybe ADHD or autism or something like that, because you can have more than one thing, right? So 70%, but that tells us that over 80% of kids that we test are not dealing with auditory processing problems, but the other things that they're dealing with.
Yep.
Interesting.
Okay, I have 2 questions. The first one is, what age can you diagnose auditory processing disorder?
So that's going to be based on the normative data. And so that would be about 7, 8. Okay. And I would say, did a lot of reading in preparation for this little chat to make sure I was going to speak to the point. I read a study that I thought was really interesting, looking at kids that were younger. They were looking more at like 5, 6, and it was comparing kids from that point to like age 10. And what they found, which I see, is that the kids that are less than 7, they can't do the tasks very well. And what was interesting is in the discussion of each of these studies, it was a 2015 article out of India, but when they were looking at it, each commentary they made was, a 6-year-old can't do this task very well. A 6-year-old can't do this task very well. So it's like, well, then why are we testing them? And I think the idea was, can we identify a profile of these kids so we can test them later? The answer was still no, because we still can't figure it out. And there was so much growth that happened from ages 6 to 7. And I can tell you the norms for our protocol are huge at age 7. So you can do really poorly and still pass. So I just think that there's so much variety. And I think this is what a lot of people don't understand. There's so much variety or variation, I should say, in how the kids are exposed to sound, language stimulation, whether or not they've had this huge history of middle ear pathology, if they've learned how to listen, if their parents have really focused on that as part of their parenting processes, which I would recommend, that makes such a huge difference in that child's ability, which is why language is so critical to have before we do auditory processing, because it's the chicken or the egg, right? But if we don't have good language skills, we're sure not going to be able to process what it is we're hearing.
Nope.
So we really need that child to have developed enough that we have a really good basis. And if you do it before that, like I said, I mean, if that kid is in a really noisy environment, hasn't learned how to listen, has had a history of middle ear pathology, there's so much development going on in their brain anyway.
Makes sense.
You really can't test them earlier.
Yeah. No, that
and
makes
get
sense.
valid information you can do something
that
with.
Makes sense. Yeah.
My other question was, have you seen an increase in people coming in with these concerns of their child having auditory processing disorder? Are you testing more children for this in the last 5-7 years?
Ever like COVID or something?
even just like the increase in all the other things we see, right? Like, ADHD and autism and, increases in those. Is there some sort of connection, correlation? Are we seeing patterns?
I would say not necessarily. Okay. I would say in general, we're seeing probably more testing happening in general. They still go in spurts, like right before the school year starts, and then maybe in January, February, before the next round of IEPs. And I would say that I see several, because of neuropsychology, wanting to do like a rule out. So I see a lot of that type of thing. And I see a lot of parents that have concerns. And so, again, they look at Google, and Google says it could be this. But I don't necessarily think that I've seen an increase in diagnoses.
Okay.
No, I would say I probably see more people that have, more kids that have like ADHD and other things that way. I even had a parent come in who was like in his mid-40s, and he's like, I'm just having a terrible time. Come to find out, like as he's explaining things, like he's got major anxiety. I don't know if he was treating it. I was like, you might want to go talk to somebody about this, because I think how you're feeling is affecting whether or not you can focus. Because if you're upset about something and you're tired, that's going to definitely affect your focus.
Yeah.
So I talk with my hands a lot. And you guys are so good at keeping your hands still.
No, I normally do too when I'm talking. But tell me more about the middle ear pathology you keep referring to.
So fluid. It's really common. We break kids up into thirds. Like 1/3 is going to get maybe 1 to 3 ear infections. 1/3 will get 4 to 6, and then 1/3's pretty chronic.
Wait, hold on. Sorry to interrupt. Is there there's not a fourth, like into fourths of kids who never get ear infections?
Most kids get at least one.
Interesting.
I don't think I've ever had an ear infection.
My son has never had an ear infection.
Then you guys are anomalies. Look at you.
I know I had probably at least one when I was a kid, but like my son who's 11, we never had to deal with that.
My kids haven't either, knock on wood.
Yeah, yours are still young though.
I know.
Anyways, interrupted. I was just curious.
No, I would say we do it in thirds, because that's usually what the population.
Yes.
I mean, not to say that you could have a sliver that don't ever have any.
So interesting.
But I would say when you're thinking about middle ear pathology, I block it into those groups of 3, so that the ones that I'm more concerned about are going to be the ones that are chronic. Yeah. And then the ones that have to get through that 4 to 6 period are usually the kids under age 2, where they might get a couple every season, but it's not horrendous. And then they grow out of it and they're fine. Okay. But it's an anatomical issue. I mean, basically your eustachian tube is parallel to your nasal cavity, essentially. And so the fluid can't drain. And by the time that they're 4, your eustachian tube is now in a 30-degree angle, ear to nose, and it can drain out. And it can't do that before that, which is where the tubes come in, because the fluid just gets backed up.
Yeah. So it's expected that most kids will get at least 1 ear infection in their lifetime.
Anatomy.
Before the age, did you say 2 or 3?
Well, 4
Look at me not listening.
Yeah. Age 4 is when we've got that
changes.
Appropriate anatomy. But, by that time it's fully in a 30-degree angle.
Gotcha.
And I always do that when I'm describing it.
Yeah,
it was
so helpful.
I'm glad you did. I'm glad you did.
Okay, so our theories, our hypotheses.
Yes.
A connection between sensory processing disorder and ear infections, vestibular processing, auditory processing. Have you noticed anything? Have you seen a connection?
I guess it depends probably on how long those ear infections have been going on untreated.
Or kids who get more ear infections, or kids who get tubes. Like, are you
chronic.
noticing? I think research should be done on that too, because you know, like you said, a lot of kids are getting those ear infections, and how is that impacting their ability to process and modulate the sensory input, specifically vestibular and
So
auditory?
I think, I mean, again, if we treat it with tubes and the tubes are staying open and the kid's okay after that, which is the majority of the time,
Yeah.
then we're fine. And it's just this like one-time thing, maybe two-time thing, and the kid is fine. And you just carry on like normal. The ones that are more chronic that have multiple sets of tubes, I think they have some things, but I think it's also more because of the deprivation factor. Like, at what point do we put the tubes in? How long are we monitoring them? Like, we have to build our case again. Our parents maybe being super proactive about listening strategies that they're really working on with their child. Are they noticing their kids a little bit off? I mean, if a child has a hearing loss, there's a 40% chance that there's going to have something else. Some of that is undiagnosed vestibular issues. So like at our clinics, we're actually starting a whole, well, we've started already, I should say past tense, a whole vestibular program because of that very thing. But it's not necessarily the OME kids or the middle ear kids. We're talking about the more permanent hearing loss kids. But I mean, I see it like in that one little girl that had that sudden hearing loss that I mentioned earlier. I mean, that was one of the things that I had her do, because I was like, we need to do all the things. And you did say she kind of leans to one side, so let's just see if this is a concern. It turned out not to be. So happy day.
When in doubt, rule it out.
Right, exactly.
So fascinating. Okay. That's good to know, because we did a podcast episode on it. We have people who talk about that too, and who ask us, like, do you see a connection? And I mean, clinically, we've seen a connection, you know, of kids who are having those chronic ear infections, and then they get to us, you know, when they're like 7 or 8, and it's like, wow, you have a lot of vestibular challenges, a lot of auditory challenges. Is this a connection? Is it not? But it's interesting to hear your take on it too.
I think it needs to be, like I said, has that been managed well? I mean, some kids that, like, I've had a couple of parents say, well, we don't go to ENT, we just, you know, garlic oil or something. And it's like, okay, I don't know if that works. I'm not going to even go down that path. I would not do that path. I would do a different path. So, and did for one of mine.
Okay. Okay. No garlic. Okay.
No garlic.
No garlic. I did put breast milk in my friend's ear who had swimmer's ear when we were in Hawaii. He didn't know it, but we all did. And he was like, a couple days later, he's like, dude, that worked. And I was
breast
like,
milk is
great.
amazing.
It was my breast milk. And he's like, oh, great.
It's amazing.
I know.
That's funny.
All the little things.
So if a child does have auditory processing disorder, they come to you, you do the test, affirmative, yes, this is it. What's next?
So the first thing we would have done is get a language evaluation on that child.
Okay.
So, and not just like something we'd find at school. At school, they tend to, and it's just because of resources, they don't do as deep a dive as we would do at our clinics. And the speech pathologists we work with specifically work with hearing loss and auditory processing. So I would definitely want them to see one of our friends. But we've already would have looked at that. And then when we see the auditory processing stuff, bring it together, and I would just send them back to our SLP and say, he's going to help or she's going to help with the building of the plan. So that'd be the first thing. The next thing would be me thinking about how that child is in the classroom and really trying to come up with some good environmental modifications, perhaps, to help that
was my next
whole
question.
situation. Like, can that teacher put that child up a little bit closer? Maybe not the front row. I'm more like first third of the classroom type of gal. Like, you don't have to sit right there underneath the teacher's nose, but having that closer proximity, maybe really being aware of the little peeps they have around them, so they're not so loud and distracting. So just especially like when they do the groups, like 4 kids at a table, like being aware of who those people are for that child. If that child is a candidate, like looking at the type of auditory processing issue they might have, are they a candidate for an FM system, which improves that signal to noise ratio. The teacher wears a mic, and it can either be through the classroom, which would help everybody, or personally for that child if they would tolerate something like that. So I'd be thinking about those types of things, in addition to we really need to do some maybe direct intervention strategies, and then we would go from there.
Okay, my next question.
Yes.
Programs like the listening program, integrated listening, are you familiar with those?
I've heard of a couple of them. Yeah, integrated
Vital
listening.
Neuro, thoughts on using those tools to improve auditory processing?
I think it's fine.
Yeah.
I think it's fine. Anything that we can do to build listening skill is probably really key.
Yeah.
Especially since a lot of kids don't get that type of particular practice when they're young. I find, and I'm not calling anybody out, so I don't want it to come out wrong, but I would say like half of my parents that I work with do a really great job to be involved with their kids and really work with them. And those kids, when I test them in the booth, really young, like 9 months of age, I can tell that those kids know how to listen. Like you can tell right away. They're really good listeners. They respond beautifully. And then about half of them, not so hot. And I find that the ones that use screens more, they're not as good of listeners.
I was going to bring that up at one point and ask if there were things from a parent standpoint that we want to do, but also don't do. And I was kind of thinking screens were going to be on that list.
Screens are definitely a thing I would not do. And I know everyone has to take a shower and go to the bathroom. So like one episode of Bluey is not going to kill anybody. However, it's the plopping them down and you're on your phone, not communicating with them. That's a problem. Or reading, but not reading what that child's doing. It's that more didactic intervention, like where you sit there and you're like, let's look at this book together. And I have a lot of parents that say, oh, my kid doesn't like books. And I was like, you as a parent have to make the book interesting. 2 of my 4 kids did not really want me to just sit and read to them. I had to make the book do something. So then I would find books that did things, whether it was pulling or a pattern or touching, textures, or if I just made it interesting by singing, some songs. I have a Wizard of Oz book and I would literally sing all the songs, not the whole thing, mind you, snippets to make it fun. But interacting with the child in that way, or even if the kids just turn the page, oh, you're turning the page. Oh yeah, turning the page again. Smack that son, turn the page. Just talking, making it interesting. You start building those opportunities and you're teaching the child we're going to have more sustained auditory attention. We're going to be focused on learning listening skills and language. And we're, if I ask you a question, you have to respond to it. Like we're starting to kind of build those skills out early. And you would ask like, what else can you do? I'm just going to speak for a brief moment about listening skills, and you can teach them starting at age 2 months, which I know you go, oh my goodness, how in the world do you do that?
No, I love that. I love it.
Here for
because that's one of the things that we talk about a lot in early intervention is like talk to your baby. They're not going to talk back because they're babies, but you're building so many skills when you talk to your baby and when you're wearing your baby and you're going on a walk and you're narrating and talking and showing and pointing. So important. So I just like that you are saying the same thing.
That's something I tell parents all the time is like one of my things on my reports all the time, but I say this to parents is you must read, sing, talk, and narrate to your child and have periods of quiet in your home when your child's awake. So like to teach a 2-month-old to listen, I did this with my little N of 4, but to be done nursing, baby would have spit up, have to go to the sink anyway because I got to like clean all the folds. And baby would be...
visual. It's taking me back.
But baby would be looking over my shoulder and I'd go to the sink and my house is quiet, so the TV's not on, the radio's not on, and if there's another kid in their house, like that doesn't matter. It's not their noise that's the problem, it's the background stuff. But they're looking over the shoulder and I turn that sink full on, it's this big psh, and it's not like they're looking at it going, oh, there's the water, Mom, what are you talking about? It's more just that, what is that sound? And then they just kind of stare at it and I go, oh, there's the water. And I turn it off. Where'd it go? And I pause. Baby looks back over my shoulder and repeat. Just that sound, response, I comment. It's just that back and forth. It is. It's very simple. I love that. But that's how you parent. Like that's how you're teaching it, is you're just doing it in a natural thing, but you have to allow for that pause.
I love the pause.
Right? I mean, if you don't pause, if you just anticipate all the time, the child has no reason to communicate. They have no reason to pay attention because you're just going to swoop in there and do it anyway.
Well, and they don't have time to process what you're saying, especially for what they're hearing for our younger kids, especially because they're still learning how to process all of these things. They need a little bit of time to process and formulate a response, and they can't do that if there isn't that pause and that quiet.
Even for our older kiddos, like my son's 4.5, and he'll hear something and he'll be like, what was that? And I'll be like, What do you think it was? Like giving them the opportunity to figure it out and problem solve on their own. Whereas like, it's the dishwasher, dude. Like, come on, you know,
Right.
instead of like telling them what it is, giving them that chance to figure it out. What about the metronome? We use the metronome in a lot of our therapy activities, and turning it on, matching the heartbeat, 60, doing motor movements with it. Is that something that you've ever looked into?
Oh, yeah. I mean, I don't do therapy, so it wouldn't be something that I would necessarily do. But really, I mean, language is musical.
Yes.
So there's a whole app called Baby Beats from one of our cochlear implant programs that I had done it was a lunch and learn type thing, but introducing that, and that was like so cool. But really, it's about like patterns and rhythms, and can kids do that? And doing nursery rhymes. Like there's a whole generation, I think, of kids that have missed out on that because people just didn't do it as much. But they should, because again, it's that rhythm, that cadence, and imitating how we're talking. And that's one of the questions I ask parents, you know, when you're listening to your baby babble, do you hear the fluctuations in their voices the way that you talk? Because that is also actually very, very important for language development, but then also important does the parent pay attention to the child. So I'm asking that question for kind of a twofold reason. A little bit sneaky. But I think it is important that we give these opportunities. And even when they're older, like the concept of freeze dance is fantastic. Or I'll tell parents, you know, play hide and seek with a purpose. So you hide behind a chair, like even just behind this little arm of the couch here, and you call the baby's name, and you're looking for them to find you because they're hearing you. So then we're like building in this concept of learning and listening in our play.
Simon Says, you know,
what's that game where you close your eyes, Marco Polo?
Oh, yeah.
And you have to like go towards them when
stop, walk, wiggle, sit. Yeah.
And I do another one where, like, you know, kiddos like 4 and guess who, except you turn it around instead of just asking random questions, which is a great skill to learning how to ask questions. But now it's the listening thing. Okay, my person does not wear lipstick. And then if you want to make it more complicated, you add 2-step instructions or 3-step instructions, where you can even add a little bit of noise in the background. You start again to raising that bar of like, we're working on listening skills. Coloring, again, following your instructions, like draw me a yellow circle, draw me a red triangle over the yellow circle. So you're working on all sorts of listening skills, prepositions, again, language developmental things.
Okay, audiobooks, same benefit as reading? Close?
Yes, from the purposes of if they already kind of know some of that stuff. If it's a familiar story.
Okay.
If it's not, I'd still want it to be a person to person.
Okay.
I don't know if the library still has this, but I know when my son was a toddler, we would go to the library and get the audiobook and the physical book with it. And so it was like a CD at the time, and you could put the CD in the car, play it while you're driving, and then he would look at the book while it was reading to him. I don't know if the library still has those, but I feel like those would be great. That's a great especially like if you do have multiple children, you have multiple appointments, therapy, sports, all those things, and you're driving around a lot and you're like exhausted and don't want to read with your child because you're so exhausted, maybe that's a good alternative.
Absolutely. Well, and I think it's also really good to be questioning yourself if your child's not developing, you know, like for instance, I'm going to use my own example. My 4th daughter was not doing the language explosion I expected her to at 18 months of age. And I was like, what is wrong? What is wrong? What am I not doing? What do I need to be doing? I'm like, I'm never reading with her. Of course I'm not. I had 3 others working full time, all these things. And I thought to myself, when can I talk with her? I was like, the 20 minutes in the car to and from daycare. I used to think to myself, all the things I have to do, my own mental conversations. I used to sing to myself, whatever. And I suddenly realized I need to talk to her. And so we would just say, uh-oh, say mama, say dada, back and forth. 2 months later,
Interesting.
Just that little change, that little 20 minutes.
My go-to is always the walk. You know, you take your baby on a walk, and instead of popping in a podcast or like listening to something, sometimes we need that, but talking about what you see, what you feel, what you hear, and just using that opportunity too of like, hey, we're going on a walk, I'm tired, I need a break, but also this is a great opportunity for us to connect and explore our environment and make those connections too.
Yes. And then you're still teaching like listening and tuning in, and that's the thing, is
tuning in. I like that.
The hierarchy of listening is auditory awareness, and then after that it's discrimination, and then it's identification, and then it's comprehension, and you cannot skip any of those steps. And the kids that we find it's kind of like with when they're reading fast, but they're not understanding what they're reading. They've lost that fundamental concept. And so we can't skip any of those hierarchies of listening for the same reason, because then later on, they don't know what to do with that information because they really haven't gone that building
order
block.
again.
So we've got detection, then we've got discrimination, being able to tell the difference between two things, identify what that thing is, and then comprehend what do I do with it. And you do that. It's not just like they do it one time. They do it with like every single thing that they're doing, like the doorbell. Okay, that's ding dong. That's different from the phone or the microwave. And then what do I do? Where is it? And then am I allowed to answer the door? Like there's all these things, because there's this like response, but what does it mean?
Gotcha. Okay, circling back to auditory processing disorder, for our small percentage of kids who truly do have it, we talked about a few of those modifications in the classroom. Is there any other strategies that you send home with your clients to implement, or modifications in the classroom, or anything else?
Yeah, we developed with the help of our speech pathologist, a whole list of different things that kids can do. So I might send that home with the parent. I might ask him, I'll talk to him about listening stuff and really working on that type of thing. But then there's like some online things. I might send them home with that as well. But a lot of times I know, like the speech pathologist I'm working a lot with is Josh Barnes. He's amazing. He will bring all these things together, and he does a lot of really amazing connections with some of those environmental modifications and things that they can do at home. So in that particular sphere, I'm functioning more like, this is the information I have. Now let's pass it to the therapist who's going to bring that all together.
The speech therapist will probably be the one giving the home programs and the things to do that make sense.
No hearing aids, no modifications for our kids with auditory processing disorder?
Well, so yes and no, right? I think that there's really two things that audiologists can do. We can do FM systems. So it really depends on, is that an appropriate accommodation for the particular situation? If the child is like in middle school and up, are they going to use an FM system? Really depends on the kid.
They're really like a typically developing kiddo and they just have some auditory issues. Probably not, right?
Right. Yeah. Because even kids with hearing loss, that maybe we've really encouraged them to use this tool, to use all of their different things. It's an auditory system. All of them go through this. I don't really want to have to give this to my teacher, which I get. It's
a social.
It is. It's a social thing. And if we can figure out how to not make it something awful for them, they're going to do much better. They really, really will. But I get that. So is an older kid going to do it? Probably not. And then I would say most of the time we don't need to do low gain hearing aids, but if we did, that would be something I would trial first. I'm not going to just fit a kid with that. I want them to come back to me saying, I love this. Now, that's not to say that I haven't put hearing aids on kids that I would be like, I don't know if you really need this, because again, if they come to me and they're like, I'm having such a hard time, that's their motivation.
I see.
But if I diagnose them with auditory processing and they're not like, oh my gosh, I would just want to hear, I'll do anything to hear, they're probably not going to wear them. It's going to be a wow effect for 2 months and they'll take them off. And then their parents have just spent a bootload of money for very little gain.
So then does insurance cover any of this?
Not typically. Private insurance usually doesn't, because they're going to do it for hearing loss, but not necessarily for APD. Some insurances will cover FM systems, but again, it just depends on whether or not the child will use that. And my approach is always to do a trial first. I really want to make sure that the child and the parent are invested, and then they're going to do it, because it doesn't help to have insurance pay for it or even have the parent pay for it and put that much money out if the kid's going to go, I really don't want to do that. It's not something I'm going to do.
You asked a question when we weren't recording that I think we should ask again, which was, can you tell that somebody has auditory processing disorder just by having a conversation with them?
Yeah, no. Again, you can't look at a symptom checklist and go, yep, you've got it, you don't. That's why we would need to test someone. But like we've been chatting about, if we have other things, we probably should address those other things first. So like if a kid has just been diagnosed with ADHD, let's address how we're going to remediate that, how we're going to work on strengthening that kid's strengths first. And then if we're still running into problems, then maybe we look at, ensuring language is good, but then also looking at the auditory processing. Auditory processing should never be the first stop. Ever.
Gotcha.
Ever. Because it's likely not that. And there's so many other impacts, because like I said, it's a bottom up. And all these things that people are more concerned about are usually top down.
That's
like
true.
The effect of language delays, the effect of like attention, like my kid just can't focus. And I think kids are really busy, and that's fine. But it's almost like because we're not outside as much, you know, doing good hard
Heavy work,
labor, that they can't sit still. And then we give them an iPad, which visually stimulates them, but it doesn't get out that other energy. It doesn't necessarily help.
Yeah. No, I'm just like rethinking so many of my clients who I thought maybe had auditory processing disorder, but, you know, ADHD, anxiety, autism, even language barriers because they were in a bilingual household. And I'm like, maybe it wasn't auditory processing disorder, and maybe it was these other things. And, you know, even if it was auditory processing disorder, maybe it wouldn't have mattered because we were still working on all of those things already.
There's a lot of strategies that we're going to do that are going to overlap some of those things in particular. But I mean, if they had something, like let's say they weren't good at being able to match pitches with music, hopefully we would pick that up with like they're not good at rhythms, right? And then if they can't carry a tune, maybe one of the things we want to do is work on that strategy, regardless of whether or not they may have a problem with that, because they could have issues with prosody, right? Being able to tell what someone actually is saying. And
yeah, I can't carry a tune.
Maybe you need to get some music lessons. But that is something that I recommend because that can really help teach the brain the difference between pitches, which is important for when you're saying something with sarcasm, like, I love your necklace versus I love your necklace. You know, like you can say something 7 different ways, saying it the same, you know, some words and words, but different meanings.
Okay,
right?
but see, I can identify that.
Well, then
I just can't carry a tune myself.
Okay. Well,
so I'm probably
just saying,
okay.
You're probably okay.
And I just think, like, my son was singing something the other day, and I was like, ooh, you are off tune. Like, you can teach that to someone? You can teach a kid how to
match a pitch?
Match a pitch?
I would think so.
Okay.
I mean,
I
think there's definitely some, like, naturally gifted people, but then I think...
Like you, probably.
But then you can kind of teach it, like, match, you know, sit there, match my pitch.
Okay. I'll work on that.
Yeah.
Okay, I do have one more question.
Sure.
We are very passionate about primitive reflexes.
Okay.
Have you heard of them? Have you heard a connection between...
It's really funny. When you originally contacted me about this, I'd actually had 2 other people mention primitive reflexes, and I was like, I don't even know what this is about. So I looked it up a little bit. I don't know that I would be able to offer a lot of information. I probably would want to maybe have some further evaluation done.
Yeah.
But when I think about it, I mean, auditory processing takes a while to develop. I mean, when the child's brain's actually done with their auditory processing development, it's like ages 12 to 15, depending on the research you read. So, like, how much would be retained from that? I don't know. I mean, you guys would know far better, like, how long that can really have an impact on their development. But I think probably more is going to be the listening environment, the listening skill development, how the parent responds to them. Again, that whole, like, let me teach you how to listen. Let me teach you to tune in. It's that, you know, the auditory hierarchy we discussed.
For a kid who's stuck in fight or flight and anxious and uncomfortable in their skin, like, they're not going to be processing things as quickly and as efficiently as a kiddo who has an integrated Moro and they are able to get out of that fight or flight.
Right. And then that's going to, that fight or flight is going to totally affect everything that they do. And it has nothing really to do with auditory processing. So we have to work through the other stuff first.
Yes.
I feel like we could talk to you for hours.
No! You are so fabulous. Thank you. This is so great. Thank you for letting us pick your brain and just throw all of these random thoughts at you.
We appreciate you coming in. It was great to meet you and talk to you in person.
Thank you very much. Appreciate the opportunity.
Of course.
Thank you so much for listening to All Things Sensory by Harkla.
If you want more information on anything mentioned in the show, head over to harkla.co/podcast to get the show notes.
If you have any follow-up questions, the best place to ask those is in the comments on the show notes or message us on our Instagram account, which is at Harkla_family or at All Things Sensory Podcast. If you just search Harkla, you'll find us there.
Like we mentioned before, our podcast listeners get 10% off their first order at Harkla. Whether it's for one of our digital courses or one of our sensory swings, the discount code SENSORY will get you 10% off. That's SENSORY.
Head to harkla.co/sensory to use that discount code right now.
We are so excited to work together to help create confident kids all over the world. While we make every effort to share correct information, we're still learning.
We will double check all of our facts, but realize that medicine is a constantly changing science and art.
One doctor or therapist may have a different way of doing things from another.
We are simply presenting our views and opinions on how to address common sensory challenges, health-related difficulties, and what we have found to be beneficial that will be as evidence-based as possible.
By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or your child.
Consult your child's pediatrician or therapist for any medical issues that he or she may be having.
This entire disclaimer also applies to any guests or contributors to the podcast.
Thanks so much for listening.